Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. Here are some of the highlights this hour. Primary and secondary schools in Abia and Gombe State announced resumption Monday 28th September and October 5th, 2020 respectively, sues for strict measures to COVID-19 protocols. Imo State government receives food and materials from Coalition Against COVID-19 for vulnerable households in the state. And concerns grow over COVID-19 in the UK, with new restrictions announced in Leeds, Stockport, Wigan, Blackpool as trial of a new vaccine to train the immune system to fight COVID-19 begins. The Nigeria Center for Disease Control has published a new public health advisory on 10 essential measures to prevent infectious disease outbreaks during flooding. This year, the Nigeria Emergency Management Agency, NEMA, warns that flooding may affect 275 local government areas in 28 states across the country. To this end, Nigeria is currently responding to the COVID-19 pandemic with cases in all states of the country. And given the risk of flooding, it is important this period to take precautions to prevent the occurrence of other infectious disease outbreaks. That's from the NTDC. In the meantime, the coronavirus is surging in many countries, with some having more success than others, which are seeing infections rise again. The NTDC confirmed 125 new cases recorded in 12 states, plus the Federal Capital Territory. Lagos recorded the highest at 37 cases. Till date, the cases are 57,849 cases have been confirmed, 49,098 cases have been discharged, and the death toll is at 1,102. Recorded in the 36 states and the FCT. In Asia, the virus appears to be spreading much faster in India than elsewhere, with the country recording about 90,000 cases a day in early and mid-September. The rise in infections comes as the government continues to lift restrictions to try to boost the economy, but the surge is also a reflection of increased testing. In Latin America, Brazil has the highest number of deaths, with nearly 140,000 so far. It has also recorded more than 4.5 million cases, the third highest in the world. Newly confirmed cases in the region are also rising quickly in Argentina, which now has more than 600,000 infections. In the Middle East, Iran has been badly affected by the virus and confirmed its highest number of new cases earlier this week. Cases are also continuing to rise in Indonesia, and the country has recorded 10,000 deaths, the highest number in Southeast Asia. Now, ahead of plans to reopen federal government-owned tertiary institutions across the country, the National Association of Academic Technologists, NAT, they're asking the federal government to address all pending labor issues in the sector before campuses are reopened for lectures. Addressing journalists in Abuja, the president says that pending labor issues, including salaries of members, funding for research laboratories, and all pending allowances, should be resolved to ensure a smooth takeoff.
There is urgent need to resolve all issues that might lead to total and indefinite strike action as directed by the Nigerian Labour Congress, of which NAT is an affiliate. Our great union, NAT, is in support of withdrawal of services by all affiliates of the union, because we do not in any way support government increasing the pump price of fuel, and at the same time increasing electricity tariff. That is, that will reduce the quality of life of our citizens, and it is totally unacceptable. There's also urgent need for government to find a lasting solution to the demands by the university-based unions, which in any case has also led to strikes. ASU presently is on strike, Other unions have given notices of strike. Of course, we have already issued a strike notice to federal government that once they announce the opening of school, our union will have no other option.
The Abia State government has announced that primary and secondary schools in the state are to resume Monday, 28th September 2020 and complete the third term of the 2019-2020 academic session with one-week revision classes. Third term promotion exams, which is expected to start Monday, 5th October to Friday, 16th, will be used to assess the students based on the tutorial from the first and second term, as well as the radio television classroom programs. The state government further announces that the first term of the new term 2020-2021 session for primary and secondary schools will start the 26th of October 2020, as teachers will go on a one-week break to enable them mark and compute promotional examination results. The government has reminded schools to follow the safety measures, also approving partial commencement of non-contact sports in the state. Meanwhile, in Gombe State, the government announced the 4th of October's resumption date for boarding schools and 5th of October for primary and secondary schools in the state. Disclosing this today at the State Ministry of Education, the Commissioner for Education says the resumption seeks to complete third term of 2019-2020 sessions, which will last for 3 weeks.
Alhaji Muhammadu Inuaiha has approved the opening of all public and private schools in Gombe State. You will recall schools were closed to reduce the spread of COVID-19 infection in the country. By this announcement, therefore, all schools are to open as follows. 4th October 2020 for boarding schools in Gombe State. 5th October, that's the following, because Sunday, we prepare them to come on Sunday to start school on Monday. Then Monday, 5th October, for all day schools, including primary, Islamia, and Zangaya schools. The ministry, however, is calling on all school administrators, that is, headmasters, principals, to continue to observe all COVID-19 protocols for safe school resumption.
A non-governmental organization, Voluntary Service Overseas, in collaboration with the Dollison Health and Information Program, has donated palliatives, including home-based learning materials for school children in rural areas. Those physically challenged as well in Bukere, Kumbotso and Gwaza local government areas ahead of school resumption are beneficiaries. The Kano State government says it remains resolute in ensuring that education in the state is a top priority.
During the COVID-19, we were able to provide radio, transistor radios for children. This comes as a result of the fact that we realize that children are not in the rural area, are not having access to the radio program from the government. The government was doing radio program, but when the communities where we are working, the children cannot access radio because some of them don't have radios or they don't even have light to access the radio they have. So we come with the innovation of providing solar transistor radio. Within 4 hours, the radios are well charged, and the children can listen to the radio program that the government is doing. We also provide materials. Not all children learn with radio. Some are slow learner. So we all realize that. We also provide learning materials at home, you know, for the period of the closure. And these learning materials can also be taken to school.
The Education Secretary will help in monitoring. And we too, from SUBEB management, we are going to monitor. We are going to see where those items distributed, and we will be monitoring, make sure the children are making proper use of it.
Mrs. Margaret Jethro is the Secretary General, Nigeria Union of Teachers, NUTFCT chapter. She joins us on the program from Abuja studios. Thank you for joining us on the program. I'd like to begin by asking that as a body, are you confident that now is the time for schools to fully reopen, as many state governments are announcing?
Well, thank you. Good evening, viewers. I wouldn't say I'm confident, but then, as a parent, as a Nigerian, we have all seen that the religious houses have opened, marketplaces have opened, people go for their businesses, and even the exiting classes in senior secondary, junior secondary school have reopened. And with that, I think I will say, even though I'm not confident, we cannot keep our children at home forever. You know that since March, the students, the pupils have been away at home. The students are tired, even parents too. And the students, we have to go back to school. I think the most important here is to put in place the necessary thing to prevent and to control the spread of the virus. So I would advise that the school should resume, but every necessary thing should be put in place.
And perhaps that's where my next question comes in. What orientation are teachers across the country getting with regards to the safety protocols to make sure that they are followed strictly?
Yes, the teachers are part of the society. We have all heard on radio, on TV, and as teachers, we're expected to read. We read widely. We all know the do's and don'ts. We know all what to do to make sure that this infectious disease don't spread. The teachers are aware of all these safety precautions. But then, like we in FCT here, when we learn that schools are likely to reopen, when people have been making moves from states, we sent a memo to the government that before our teachers will resume, there is need for sensitization, adequate sensitization, because we still believe there are more to learn. Nobody knows everything. And more especially our teachers at the rural area who don't have access to maybe the TV and radio, perhaps. So that there is need for adequate sensitization. Before any school will resume, before any state government will ask any school to resume, we expect that necessary sensitization should be done so that teachers will be aware, will be well equipped with the necessary safety precautions.
Finally, from your professional point of view, what does it mean when you hear state governments are automatically promoting pupils while others have been given just a few weeks to finish the third term before beginning a new session?
I think that shouldn't be the best for schools to promote the pupils automatically. From the professional angle, that is not the best, because you cannot build something on nothing. As a professional, we move from known to unknown. And if you don't know something, you don't know it. There is no two way about it. I think what is expected of each government is to make sure either to maybe extend the term by maybe weeks or so, just like some states are already doing, maybe setting aside certain weeks, few weeks, to make sure that those things, because in most schools, they don't do exam before the lockdown. And as a result, I will advocate that maybe a month or few weeks should be set aside to teach these pupils and students what they need to know before they move to the next class. Instead of maybe having holiday of 1 month or 3 weeks, we may make the holiday to be just 1 week, while we use the remaining weeks to teach these students what they need to know. It's very important they have the necessary foundation. If not, it will be a problem.
We'd like to thank you. Appreciate your time on the program. Mrs. Margaret Jethro, the Secretary General, Nigeria Union of Teachers, FCT chapter. Thank you for joining us on the program.
Thank you. You're welcome.
We take you to Imo State, where our correspondent Eitokwe Kute brings us an update on the latest efforts of the coalition against COVID-19.
As part of efforts to mitigate the effects of COVID-19 pandemic on vulnerable Nigerians, the private sector-led Coalition Against COVID-19, also known as CACOVID, has distributed food palliatives and other relief items worth millions of naira to Imo indigents through the Imo State government. While delivering the items to the Imo State Governor, Hope Uzodinma, at the Imo State International Conference Center in Owerri, the Imo State capital, the representative of CACOVID said this gesture is to complement government's effort in cushioning the effects of coronavirus disease, and about 1.7 million Nigerians across the 774 local government areas in the country, including the FCT, are expected to benefit from this gesture.
A part of our efforts to support the government in tackling the COVID-19 pandemic that has deeply affected the livelihood of many Nigerians, the private sector coalition against COVID-19 has committed to supplying relief packages to the most vulnerable.
While commending CACOVID for their efforts in alleviating the sufferings of vulnerable ones at this time, the Imo State Governor Hope Uzodinma said the government will ensure that these palliatives get to the right beneficiaries.
We have invited 27 local government chairmen who today are local government focal persons. I want to charge you to just comply with guidelines produced by CACOVID, distributed and given to you by the Office of Chief of Staff and Secretary to the Government. This is service to humanity. We cannot afford to fail. So as you go to your various local governments, ensure that these items are...
From Owerri, the Imo State capital, Eyitope Kuteyi, for COVID-19 update.
Still monitoring the trends of COVID-19. Joining us from Abuja is Dr. Ogbonnaya Iheme. He's the Medical Director, Prime Care Hospital, Abuja. Thank you for joining us on the program.
As usual, my pleasure, Millicent. Good evening, Nigeria.
What's your observation of our efforts at flattening the curve? Do you think that we have or we've had evidence-based response to the pandemic?
Sure. If we see the recent statistics that NCDC has been giving us, as far as the figures, the new cases are concerned, one can see a consistent drop in the figures we're having. So even sometimes you can even stay 24 hours and you will not even see any deaths. The figures have been consistently low. We are talking about figures of a little above 100 plus, and in some cases less than 100, and you can even see 24 hours no death. I think those efforts are, that the federal government, through the PTF, has been putting in place are surely paying off. One can even stick out his neck and say, yes, sure, there seems to be a flattening of the curve of COVID-19 as far as our own control is concerned.
Staying with the NCDC, in the public health advisory, they've been telling health workers, they're advised to maintain a high index of suspicion for COVID-19 when attending to patients and also taking detailed information. As a private practitioner, do you think that there has been compliance? And this is also the importance of testing frontline health workers, if you think that this strengthens the pandemic fight.
Sure. As far as we are concerned, I think the workers themselves, the health workers, get tested. Most of the times, we should not actually wait for you to be, symptomatic. We encourage you to go in there, get tested, because most of the times COVID-19 has been shown, in many cases to be asymptomatic. So most of the times, yes, even though we will always want to, want to indicate, high index of suspicion has to come into place, but it's also, advised that this healthcare practitioners, as much as possible, must go in for their test, even while they are asymptomatic. And I would also say say kudos to NCDC, because as much as possible, the information is really getting right. I mean, every day, I mean, getting right to the healthcare professionals. And then, of course, the incentives are coming in terms of their hazard allowance are being paid, and as much as possible, the materials that are needed, even with the difficulties and challenges that we are having in terms of provision and distribution. But I want to give them a high ups, and as far as the testing, and then as far as the healthcare, the frontline practitioners are concerned, I want to give them a high ups on that regard.
Just quickly, this is a final question, if you can, in a sentence. Do you think that a vaccine today will put an end to COVID-19, or that we should just start getting comfortable with the new existing tools to responding to COVID-19 cases?
Sure, vaccine will play a very large role as far as stopping COVID-19. We are looking at cases that have not like what we call infection naive cases. Who take these vaccines, especially the vaccines that have been certified, certified fit by the relevant authorities. Like for instance, we are talking about the Chinese authorities are developing. Even though it has its own challenges, I understand that it has not gone through the phase 3 clinical trials. But so far, so good. I mean, the reports are coming that way, shows that it is, it's also giving a good report. But what actually we want to say on a final note, that vaccines will go a long way towards helping prevent COVID-19. We are talking about the ones that are actually naive, the ones that have not actually contacted. But once somebody has contacted COVID-19, vaccines may not have actually got no role to play in that case. It's actually one has to now either you sit it out or you get treated for it.
We appreciate your time. Thank you so much, Dr. Ogbonnaya Iheme, Medical Director, Prime Care Hospital, Abuja. Thank you for joining us on the program.
My pleasure, Millicent.
The London mayor has warned that it is at a very worrying tipping point amid a resurgence of COVID-19, with new restrictions have also been announced in Leeds, where the city council reported a steep rise in infections today. In the meantime, with official warnings of a potential twindemic as COVID-19 cases surge in Europe just ahead of the flu season, WHO is recommending that people get a seasonal flu vaccine to prevent hospitals being overwhelmed. Here's more on the global update.
Final phase 3 trials of a Chinese coronavirus vaccine began in Turkey's northwestern province of Kusaheli as vaccine maker Sinovac Biotech unveiled plans to widen its test with children and adolescents later this month. 10 volunteers are taking the first dose of US-listed Sinovac's Coronavac or a placebo at Kusaheli University Hospital per day, and the vaccine will be administered to more than 1,000 volunteering health workers over 10 days, and the second dose will be given 14 days after the first shot. Israel is preparing to tighten its second nationwide COVID-19 lockdown as critics seize on new protest curbs to accuse Prime Minister Benjamin Netanyahu of trying to halt demonstrations against him. Israel's parliament has not yet approved the new measures, and the Prime Minister's office is preparing to ratify curbs in protest until Tuesday, September 29 by emergency decree. The tougher lockdown rules would in part restrict attendance at street protests to within 1 kilometer of citizens' homes, effectively shutting down months of demonstrations against the Prime Minister's handling of the pandemic and unconnected corruption allegations. The Spanish government has recommended reimposing a partial lockdown on all of Madrid city to curb the spread of coronavirus after local authorities imposed restrictions on just some areas of the wider region. Spain, one of the countries in Europe worst affected by the pandemic, was under a draconian lockdown from March till May, in which people could not leave their homes. The restrictions were lifted in stages and by region and was totally lifted on June 21. But the pandemic has surged again in recent weeks.
Well, as you go into the weekend, remember that a decline in the cases doesn't mean the curve has been flattened. Continue to take responsibility. Visit our website, channelcv.com. You can find more updates on the pandemic and several other stories as well. Thank you for watching COVID-19 Update. I'm Millicent Walker. Stay safe.